The mission of the division is to understand health disparities. Why do some people get sick while others remain well? Once sick, why are the courses of people's illness so very different? And also, at the same time, to address those disparities. And that has led us to dozens of countries across the world where we have engaged in long-term work, training, building local capacity, and then building facilities and conducting research. And so this is, again, part of the mission of a global institution like the Brigham Women's Hospital to think about those who have benefited least from the kind of advancements that we see developed here. If there's basic science discovery of revolutionary implication, but no plan to develop the medication or the diagnostic or the vaccine or other preventive, then it goes nowhere, right? But if you do have that and you don't have a way of delivering, then it doesn't go anywhere either. And so what delivers, what's that last mile? It's a health system. And in our experience, starting in the 80s, there's just basically three main components of the health system. One is a hospital for the critically ill or injured. Two are clinics. These are usually run by nurses, and they're spread around so that it's not entirely inconvenient for people to show up to a place when they don't need an inpatient stay, and most people don't. And third, community health workers, community-based care in general. And if you look in all the places we work, from the United States to Russia to Rwanda to Haiti, you'll see that the weakness or absence of one part of that three-part formula, hospital, clinic, community health worker, if it's weak, the outcomes are weak. The delivery capacity is weak. And this is especially true for anything chronic. So HIV disease is chronic disease. Tuberculosis, especially highly drug-resistant tuberculosis, chronic. Diabetes, complications of coronary artery disease, hypertension, asthma, these are all chronic diseases. So you can get a good new discovery, it can be developed, but if you don't have a delivery plan, the impact is much muted here. And I'll give one example. It could be from rural Rwanda or rural Haiti, but if you're doing a delivery program with fairly defined objectives, say, for example, rolling out a new therapy like antiretroviral therapy for AIDS, right? If you compare uptake enrollment in a city, for example, or a rural area in Rwanda with urban United States, and you look at that treatment cascade, so you identify a patient, you put him or her on therapy, you check later down on the line, 6 months, a year, find out if their viral load is suppressed, if they're responding, if their weight's going up, if they're not getting opportunistic infections, and mortality. Right? If you look at those cascades, those treatment cascades, Rwanda outperforms the United States on that goal, which surprises a lot of people. What they do have is a delivery platform that includes community health workers everywhere. So there's about 60,000 community health workers for, let's say, 10 million people in Rwanda. And they're spread out in small towns and rural villages, and so people have more access in some senses. Well, many partners worked on this, of course, and I'm speaking today of our Brigham faculty, but this involved years of working inside the Ministry of Health and in these rural places doing this delivery. So we recruited and trained community health workers to accompany the patients with chronic disease, particularly AIDS and TB. And the impact on mortality from common illnesses has been enormous. In fact, the steepest declines in mortality ever documented anywhere at any time have been in Rwanda over the last decade. And Brigham faculty and Harvard faculty are really proud to be part of that. Whenever there's a new development, like a new treatment, a new diagnostic, or a new preventive like a vaccine, first of all, the delivery question has to include not only how do we get it to people who need it, but how long does it take us to do that? If we don't have an equity plan, that is to reach those who are not going to be served, what we see are increasing health disparities, not shrinking ones. So we have to have that flexibility to be able to say, that's an important development. We want to make sure that our patients have access to it.